Undescended testicles are something we see very often. It's actually a really common problem in newborns. It's present in about 1 in 100 newborns. Those testicles tend to come down on their own within the first 6 months. In a significant percentage of those kids, maybe 70%. And once they come down, those kids are great. They don't need anything more. A lot of kids get referred to us when they haven't come down, usually around 6 months old. And that's what the American Urologic Association recommends for caring for these kids. If they're not down by 6 months, the chance that they're going to come down is not so great. The reason the testicles need to be in the scrotum is because in that area, the scrotum serves a purpose, believe it or not. The scrotum regulates the temperature that the testicles live in. And outside of that area, the testicle is not going to develop correctly. It's not going to, the cells that produce sperm are not going to form correctly, and eventually over the years will wither away, so that testicle won't be able to produce sperm. And if the testicle is not brought down to the scrotum before puberty, there's a higher risk of developing testicular cancer. It's a pretty fair risk, actually. Bringing the testicle down to the scrotum helps with those problems. It helps the testicle develop more normally to get to the point where it can grow normally and produce sperm normally. And it also significantly reduces the risk of testicular cancer as an adult. The reason why the testicle doesn't come down to the scrotum is complicated. There are a lot of steps in the testicle making its way down from the pelvis, where it initially forms, down to the scrotum. There are anatomic considerations, there are hormone cascades, there are genes that need to be turned on at certain points. Anything in that pathway can get in the way and prevent the testicle from coming down. Bringing a testicle down to the scrotum, if it's not in the scrotum by 6 months, is a surgical procedure. How the surgery is done really depends on where the testicle is located. Most of the time, undescended testicles are located in the groin. And to bring them down, to bring the testicle down, it's a surgery that's done in the hospital, in the operating room, under general anesthesia, so the child is completely asleep. We make a little cut in the groin and another one in the scrotum that's about that big, maybe 1.5 centimeters or 2 centimeters. We free the testicle from whatever's holding it up and position it in the scrotum. Oftentimes, there's a small hernia associated with undescended testicles. And if it's there, we'll fix it. The goal is for that testicle to make its way all the way down to the scrotum. Sometimes, for one reason or another, it may not reach after everything that we've done. If it doesn't reach at all, there's really not much benefit to the procedure. And what's recommended is actually to remove it if the other testicle is normal and in the scrotum too. Those kids, after you remove one testicle, actually do well. They grow normally, they have normal hormone production, and they have the same fertility as the general population. That one testicle actually makes up for what the other one's not doing and compensates. Well, it's surgery that's done through, it's not done laparoscopically or robotically. This is a surgery that's done through an open incision. It's outside of the belly where laparoscopic procedures would normally be done. If you can't feel the testicle on a physical exam in the office, which is the case maybe 10 to 20% of the time, that's a procedure that's done laparoscopically. Most likely the testicle is inside the belly. And we manage those by looking inside the belly through the belly button with a small camera and trying to bring it down laparoscopically.